What are treatment options for sciatica? Bed rest has been traditionally advocated for the treatment of acute sciatica. But how useful is it? To study the effectiveness of bed rest in patients with sciatica of sufficient severity to justify treatment with bed rest for 2 weeks, a research team in the Netherlands led by Dr. Patrick Vrooman randomly assigned 183 such patients to bed rest or, alternatively, to watchful waiting for this period. To gauge the outcome, both primary and secondary measures were examined. The primary outcome measures were the global assessments of improvement after 2 and 12 weeks by the doctor and the patient. The secondary outcome measures were changes in functional status and in pain scores, absenteeism from work, and the need for surgical intervention. Neither the doctors who assessed the outcomes nor those involved in data entry and analysis were aware of the patient's treatment assignments. The results, reported in the New England Journal of Medicine, showed that after 2 weeks, 64 of the 92, 70%, patients in the bed rest group reported improvement, as compared with 59 of the 91, 65%, of the patients in the control, watchful waiting, group. After 12 weeks, 87% of the patients in both groups reported improvement. The results of assessments of the intensity of pain, the aggravation of symptoms, and functional status revealed no significant differences between the two groups. The extent of absenteeism from work and rates of surgical intervention were similar in the two groups. The researchers concluded that among patients with symptoms and signs of a lumbosacral radicular syndrome, bed rest is not a more effective therapy than watchful waiting. Sometimes, conventional wisdom is not as wise as research. Subscribe us to know more health tips and home remedies.